One of the other things that I wanted to talk to you about is this myth that won't seem to die, that hormone replacement therapy causes cancer, essentially. It's very dangerous. Estrogen drives cancer. How can we put the nail in the coffin for this one?
I will die on this hill.
Just
I feel very passionate about this. If this were true, any woman who was pregnant and had whopping doses, ladies, we're talking 150 picograms per ml of estradiol is sort of being normal in the mid-cycle, average woman. We're in the thousands when you were pregnant, and yet you got out of that without cancer. How could that possibly be? Now, is it true that some tumors have receptors on them that are responsive to hormones? Yes, it's true. That doesn't mean necessarily that hormones, even in that environment, are inherently dangerous. What we know is that cancer is very multifactorial. We've got viruses, we've got parasites, we've got endogenous toxin exposure, or I mean, exogenous toxin exposure. We've got, blood sugar problems and inflammation, which can drive DNA changes at the cell. We have so many things that are at play. And fun fact for women, breast cancer genetics really are maybe 3% of contribution to breast cancer. So, women need to understand that the highest rates of breast cancer tend to be in our postmenopausal years. How do we blame a state of estrogen deficiency, or how do we blame estrogen during a state of estrogen deficiency for causing that cancer, right? Cancer can be 10 to 15 years at work before we actually become aware of it. We know that women who take estrogen therapy actually do better in terms of mortality rates, better in terms of aggression of the tumor, and better in terms of recurrence. So, why we keep hammering this has to do with some bad studies, bad information, bad interpretation of the studies, etc. And we need to kind of take that conversation and dispense with it completely forever and ever and ever. Let's please let it die, and I'll be the one to speak at the funeral. We have to stop making women scared of their hormones. Our hormones are our superpower. Our hormones are what keep us healthy. Our hormones are absolutely the critical component of our genomic signaling in this body. Stop trying to suppress them. Stop trying to dump them, stop all these things. They are helping you. If you have something going on, you need to look again at what you just talked about, the underlying issue. Is it a poor gut microbiome? Is it you live next to, we had a woman who couldn't figure out what happening. Turns out she lived next to a farm that produced pesticides. Like that was actually the production, not that they used them, they produced them. You have to wonder about groundwater contamination. Like there's so many things in it. And it's very frustrating because women have either it's my hormones or I did something. And I am so frustrated with women being made to feel like they made a mistake somewhere down the road and that's what gave them cancer. It is not that simple. If it were that simple, we wouldn't continue to have the rates of cancer that we do in this world. We have made almost no progress in terms of preventing cancer, doing some better jobs in terms of treating cancer. We are not preventing it. And we have to get really realistic that hormones actually are a homeostatic regulator. They provide balance. They modulate the immune system, which is a critical component of cancer defense. They upregulate something called P53 tumor suppressor, which maintains a state of anti-cancer cells in the body. There's so many, our apoptosis, all these people who are out there like shoving themselves in cold plunges because they want to have autophagy or something. I'm like, guess what else does it? Hormones. So it's very, very frustrating that conversation continues to come up, but we're just going to be unapologetically unequivocal. It's not your hormones, period.
period. If my mic wasn't attached to the desk, I would drop it. So that was great. That was great. All right, friends, thanks for tuning in to another episode of Radical Health Radio. We got a fresh new podcast for you every Wednesday. If you enjoyed the show, consider liking, subscribing, reviewing, and rating us on your podcast platform. It helps to spread this message of radical health. We'll see you next week.